Hello, my name is Dr. Catherine Wambua. I'm a physical therapist and also the CEO for Restore Physiotherapy and Rehabilitation Center Hospital here in Karen, Nairobi, Kenya. It's a center where we admit patients who've had issues like spinal cord injury, brain injury, strokes, and they have a goal of being able to restore function. So we admit people for intense rehab. And today I want us to talk to one of our patients, Mr. Simon, who came to us a few months ago after having a spinal cord injury. And our journey with him was to be able to restore function as much as possible. So we're going to talk to Simon this morning. Hello, Simon. Welcome.
My name is Simon. I got an accident early this year, that is in January 19. I broke my spine, 36. Taken to hospital in Abundance. I stayed for 25 days. Then from there, I was brought at the Restore Physiotherapy Hospital for rehab.
Yeah, so Simon, if I may ask you a question. When the doctor told you that you have a spinal cord injury, what came to your mind? What did you think that was?
At first, I didn't expect the level of injury was that serious. I just thought spine is just like breaking a leg or a nerve. But later on, he told me I'll never walk again. Let me see, it was tough. It was really tough.
It's tough. So, as we said, his was a T6, thoracic 6 injury. When Simon came to us, he was not able to do much. What were you able to do when you first came to, what could you not be able to do when you came to Restore?
About transfer, I could not get on a bed on my own, off the bed on my own, I could not shower, even feeding myself was a problem, and I could not get control of my upper body. I could fall easily.
Yeah, so Simon underwent a lot of intense therapy. As he has said that first when he came, he needed help of 2 people to get him in and out of bed. Over the journey of his rehab, he has done very well. Right now he has a 6-pack on his stomach, he got strong arms. He's able to get himself in and around. And one of the things we asked Simon was, what do you want to be able to do? Because we wanted to work from the perspective of the patient. And he told us he wants to be able to be good enough to go back to work. And so that's what we have been preparing him to do. So what are you able to do right now that helps you know that you can be able to go to work on Monday?
Right now I can take a shower on my own. I can dress on my own. I can do transfers from the wheelchair to the bed and the bed to the wheelchair. Get in and out of the car on my own. I can groom myself very well. Yeah, maybe say like 90%, 97% I'm independent.
Great. And so Simon, as you see him today, and should be an encouragement to anybody who has a spinal cord injury, is actually going back to do what he used to do before. And all they have to do for the employer is to make a few accommodations to allow him to maneuver the environment without much hindrance. And so this is something to show hope, that there is actually hope for those who have injured their spines. You don't have to hear you will not walk again and just get depressed and go home and get wounds. Someone right now has not a single little place in his skin that has a wound, and we have been able to prevent that during the stay of his rehab. He actually can lift himself. Okay, show me you can lift up. That's how strong Simon is. He can get himself up. He can get into a car with very little help just for his equipment. And so this is a good, even in his economic status, is going to be where it was before. And he's a father, so he's going to go back and do what fathers do. He's going to go back to his home environment and be able to transition to that. And so our encouragement is, if you hear this big word of spinal cord injury, that's not the end of life. There is hope. It is a rehabilitation journey that's going to be very helpful. And so, we are here for you. And Simon, again, thank you for being such a good, hardworking patient. We have enjoyed having you. Simon is going to be discharged from our facility today. Today is on a Saturday, and on Monday he's going back to work. He has had a very good supporting family, which is very, very crucial. because also that is part of family when you have support. And so we really appreciate him. He's been a motivation to other patients who came here without hope, and he tells them, I was so low physically and now I'm able to do this, and he's given hope to so many patients. So we thank you again, Simon. We want to wish you well. So this is not the end of your rehab. You still continue, and we'll be seeing you every so many often days. And thank you very much again.